Feet, ankles, and legs swollen. It may be a minor annoyance for some people or persistent illness for others. What is the cause of these widespread ailments? In this video, we'll investigate the mystery underlying leg edema and share some unconventional but natural remedies. First, what causes the edema specifically? That varies. Things like standing for extended periods of time or exercising too hard can cause temporary edema. Here, the reasons are clear. Long-term swelling, however, suggests a problem. Pooling fluids can be a symptom of diseases of the kidneys, liver, heart, and other organs. Even vitamin deficits in some cases might exacerbate the issue. Swelling is typically associated with an accumulation of extra fluid within the tissues. This fluid overload causes the skin and muscles to swell up like a sponge soaking up water. Since the fluid is drawn downward by gravity, the legs and feet are most impacted. But what kind of fluids are these? The primary offender is plasma, the transparent yellowish liquid that comprises 55% of blood. Plasma removes trash from the veins and transports nutrients and blood cells. However, plasma cannot be sufficiently eliminated when issues arise with the kidneys or liver, two organs that filter it. The extra plasma leaks into the surrounding tissues from the blood vessels. What was the outcome? Growing. It is also possible to link lymph, the fluid that flows through the lymphatic system. Although it functions independently, the lymphatic system is similar to the blood circulation system. White blood cells are transported by it, and it also catches viruses, bacteria, and other pathogens. Although lymph nodes filter the lymph, a backup is brought on by obstruction in the nodes or veins. After that, the lymph starts to seep into the tissues, which causes swelling. So the swollen legs are caused by an overabundance of lymph and plasma. However, why do they start off that way? Swelling essentially results from an imbalance or malfunction within the body. Let's examine a few of the crucial elements in more detail. Heart disease. Blood is circulated via the heart by the circulatory system. Blood can back up into the leg veins and force fluid out into the tissue if the heart is weak or injured. Liver disease. Waste products and poisons are removed from the blood by the liver. This can build up in the blood and cause bleeding into the legs when they are injured. Diseases of the kidneys. Healthy kidneys excrete waste and extra fluid from the blood in the urine. Fluid might remain in the bloodstreams and eventually accumulate in the legs due to the kidney failure. Blood clots. Clots in the leg veins prevent the blood from flowing normally. The blood travels by many paths, frequently losing plasma along the way. Medications. Medications for high blood pressure, hormone replacement therapy, corticosteroids, and antidepressant can all lead to fluid and salt retention. Immobility. The circulation slows down when the muscles are immobile for extended periods of time. Fluids are not effectively pumped back up because they drift downward. Vitamin deficiencies. When certain vitamins are deficient, inflammation and plasma can accumulate. This encourages fluid retention and puts stress on the organs. Obesity. Too much body fat presses against the abdomen and legs, making it more difficult for fluids to be pumped back up. The leg stress circulation causes blood to pool and plasma to spill. During pregnancy, the uterus compresses veins, causing plasma to seep into the tissues in the legs. Fluid retention during pregnancy is also impacted by shifting hormone levels. Age. Circulation slows down and organ function declines with age. In parts that are reliant, such as the legs and feet, fluids can build more easily. The list is endless. The causes range from lifestyle issues to chronic conditions. However, the principles remain the same in all situations. When the organs and systems that control fluid balance are damaged, lymph and plasma build up and eventually link into the tissues. Further issues arise as a result of swelling. When stretched too far, the skin might get damaged. As the heart tries to pump more blood via the circulatory system, fluid accumulation puts strain on it. Blood clots result from immobility caused by swollen legs. In addition to cramps and heaviness, there is pain. Thus, reducing the edema is essential. Is it possible to naturally lessen edema though? Indeed, let's look at some beneficial vitamins. Thiamine or vitamin B1 is water-soluble vitamin that is essential for several processes. Lack of B1 causes fluid to accumulate around the heart, impairing its ability to pump. This vitamin helps maintain healthy liver, nerve, and kidney function in addition to heart health. Whole grains, nuts, beans, seeds, and shellfish are the finest sources. In addition to being water-soluble, vitamin C has anti-inflammatory properties by nature. It shields organs, bones, and blood arteries. Vitamin C helps the kidneys and circulatory system, which decreases fluid retention and leakage. Leafy greens, tomatoes, peppers, berries, and citrus fruits are excellent suppliers. The sunshine vitamin, vitamin D, is essential for good general health. It lowers inflammation and facilitates the absorption of calcium for strong bones. Being in the sun helps the body make vitamin D. This essential vitamin is also found in liver, eggs, fatty fish, and fortified meals. There are various herbs and spices that are helpful in addition to vitamins. Dandelion promotes appropriate fluid balance and renal function. It decreases edema by acting as a natural diuretic. Nettle leaf has anti-inflammatory and diuretic properties. It lessens fluid retention and improves circulation. Ginger has anti-inflammatory qualities that can reduce swelling and enhance blood flow and circulation. Fennel seed has anti-inflammatory and diuretic properties. Garlic, pine bark, grape seed extract, bromelain, and essential oils are just a few more natural therapies that can reduce swelling and enhance circulation. We've now discussed the possible natural remedies for swollen legs as well as their causes. But what else is there to be done to fight this illness? These are some important therapy approaches. To help with the better drainage of extra fluid during the day, elevate your legs periodically. While lying down, even small leg lifts can assist in pumping fluids back up. Squeezing the legs with compression stockings helps to increase circulation and push fluid upwards. Blood flow and lymph drainage from the legs are enhanced by movement and mild exercise. Circulation and fluid outflow from the tissues are enhanced by massage. Diuretics or water tablets increase urination and decrease fluid accumulation. Surgery might be used to remove lymph nodes to minimize swelling or to repair vein valves, used as a final resort after all other measures have failed. Naturally, the underlying causes of the edema needs to be appropriately treated as well. If you liked the video, give it a thumbs up and share it with your friends. Let us know in the comments down below. Have you ever experienced swelling in your feet and legs? You might also want to check out the other videos in our YouTube channel. Just click or tap the videos below here. Thank you for watching.